Now, regardless of whether Obamacare is constitutional, is it good for people? Dr. Manisha Sharma of the group Doctors for America says yes, and in fact, government should do more to provide health care for people. John Goodman says no, government should do less. He heads the National Center for Policy Analysis, and he's specialized in health care. So why should government do less?
Well, right now we have a bureaucratic, wasteful, inefficient system, and when government nationalizes it, it will become more wasteful, more bureaucratic. And the only way out of our problems is to free the doctors and free the patients, let them use their intelligence and creativity to solve their own problems. We're not going to solve these problems from Washington.
And you, this week, released a new book called Priceless, and Priceless is part of your meaning is that nobody knows in medicine what things cost. The patients don't know, the doctors don't know. Why not?
Nobody sees a real price in health care, no doctor, no patient. You know, poor people with food stamps go into a grocery store, they pay the same price as you and I pay, they never have a problem with access. In health care, we don't let them do that. They have a huge problem of access.
Dr. Sharma, you had appeared at an event with President Obama promoting Obamacare. You say this is great. Why?
I believe that this is a great step forward in our health care and for our country, for us to be able to have better health for everybody in America. The bottom line is that America's health care is failing, and this is a great step forward in being able to make it into a patient-centered way of taking care of people.
Sounds good, John. Patient-centered. And the applause, I should say, she has a group of doctors she's brought with her, 10 doctors who agree with her on this, and we'll be hearing from you later.
Here's the great irony. For our most vulnerable populations, they're going to have less access to care, not more.
Why?
What this bill does is greatly expand the demand for care. It's not just 32 million newly insured, but you and me and all the seniors, all the rest of us are going to have more generous insurance than we had before. So huge increase in demand, no change in supply. That's a huge rationing problem. If you're in a plan that pays below market, as like seniors and the disabled on Medicare or poor people on Medicaid or newly subsidized people, if we follow the Massachusetts example, they are going to have a real problem finding a doctor who will see them.
So actually, I disagree with you. I'm an everyday doctor taking care of everyday people. The notion of knowing that there are going to be more doctors to take care of more people and that there are provisions in the Affordable Care Act to let that happen is a good thing.
But I'm not getting it. I mean, government isn't good at running things. It couldn't run steel mills or even produce food in the Soviet Union. Why would it make health care better?
Well, the government gives us protection, does it not? It does a good job in giving our cops and our firefighters
Well, that's
money.
local government.
But it's local
we like that.
as well. But there's the whole notion of being able to say, look, you're starting on the factor that you're saying that health is a commodity. I start on the factor of saying that health is a right. So the notion
health care is a right.
There is nothing in this legislation that gives anybody a right to any particular health care.
What do you mean? It's free. It's the government's going to bring it to you.
It does not give you a right to a CAT scan, to heart surgery. It doesn't even give you a right to wait in line. If you're the 100th person waiting for a CAT scan, that doesn't mean you have a right to the 100th scan. In Massachusetts, which is the model for the federal legislation, more people are going to emergency rooms now than ever before. Boston cab driver told me the other day she had to go down a list of 20 doctors before she could find one who would see her. And I said, were you going to the yellow pages? She said, no, this was the list the government gave me. All that's happened is we're just moving money around. People are not getting more care.
Well, actually, I disagree with you. The fact is, I'm sorry, you're a nice Southern gentleman, and I feel like, you're welcome. I do feel like that, and in no disrespect, you're a numbers person. I'm an everyday doctor. And the fact of the matter is, in Massachusetts, actually 98% of Massachusetts is actually covered. The bottom line about it is that this is allowing us to expand care for people. It is closing the gap. 50 million people were uninsured. The Affordable Care Act is giving us 32 more million people to be able to get some quality insurance.
All right, the majority of America is on her side. You know, I'm looking at these poll numbers. 72% of Americans support subsidies for the poor to buy health insurance.
I support a reasonable government policy to help poor people, but that would be giving them money to buy private insurance, not going to rationing.
Excuse me, but I don't think it's just about poor people. This is about everyday people. This is not about a socioeconomic
All right, but let me go
divide.
down this list from the poll. It's all on your side. You should let me do
No,
this.
of course.
63%. Well, just because most people agree with you doesn't mean that you're right.
No, I'm not.
Back to the poll here. 63% support government setting minimum standards for a health care plan.
These aren't minimum standards. The federal government's going to tell you exactly what kind of health insurance you have to have, where you're going to get it, and what you're going to pay for it. You're going to have very few choices.
Frankly, to be honest with you, I don't think insurance companies should be in the game personally, because this is not, health is not a corporation.
You just want full, like Canada has, government.
Well, I think single payer, if you actually look at the evidence that shows
that's
it,
government
it's
health care.
Social responsibility that everybody pitches in. So the bottom line is that here's
everybody
the thing.
pitches in. That sounds nice.
Yes, but everybody doesn't get the same care. And as a matter of fact, uninsured people in the United States get as much or more preventive care, more mammograms, pap smears, and so forth, than insured people in Canada. Think about that.
No, that's actually not true.
That is absolutely
well,
true.
there is a lot of controversy over
There's
what's
no
actually out of
controversy
the
over that.
evidence.
Next point here.
Medicine has shown in that regard.
61% of Americans support banning discrimination for pre-existing conditions.
Yes, absolutely.
Doctors are applauding here. Everybody discriminate. You for discrimination, Goodman?
I'm for people being able to insure against pre-existing conditions. That's what you do with life insurance. You buy life insurance, you get cancer, you die, your family gets the money. I'm not for allowing people, as this bill will do, to wait until they get sick. Then you buy the insurance, get your care, and drop the insurance again.
Yeah,
That's not going to work.
What about that? Why should I buy any insurance till I get sick?
So the fact of the matter is that's the whole idea, is to actually refocus on preventative care. So let's talk about pre-existing conditions very clearly here. So what are pre-existing conditions? Insurance companies were allowed to say, you have an allergy, you're a pre-existing condition. I got hit by a car, I'm a pre-existing condition. To me, that doesn't seem fair.
Do you know it's illegal in practically every state for your employer to buy insurance for you that you own? Why don't we change that law? We solve 98% of all these problems.
You guys will have more chance to answer the audience questions later. Thank you, Manisha Sharma and John Goodman. We're back now with your questions for our guest, Dr. Manisha Sharma with Doctors for America. They support Obamacare. John Goodman of the National Center for Policy Analysis, just came out with the book Priceless. And Karen Harned from the National Federation of Independent Businesses. So first from Facebook, from my Facebook page, Alan Hatton asks, why is buying catastrophic care only? Why is that illegal? And why can't you buy it out of state?
Well, these are ridiculous regulations, all coming from Washington. And basically, when people can manage their own health care dollars, they'll go to places like Minute Clinic, and they'll get the inexpensive, high-quality care for
It's
a
not
lot
legal.
of them. No.
Why not?
What's illegal is having them pay for care. It has to be free, which means they'll go to the more expensive place. They'll waste their money. They'll waste your money. They'll waste all of our money.
Yes, sir.
Why is our employers even involved in the whole industry altogether, and why can't they get out of it and just let us have our own control of the health insurance?
Karen?
Well, I think this was a policy that was set back, as I understand, during the 30s and 40s when employers were disincentivized, I think, from raising salaries. So instead, they increased benefits. But that is a very good question.
They had price controls then.
Yes.
It was illegal to raise salaries, so they said, let's give them health insurance.
Right, and what we would like to see actually is what you're alluding to, which is everyone have pre-tax dollars so they can, as you had said, have truly portable coverage, take that with them, and that employers can pay your salary. You can know exactly how much money you're making and make your own choices with that money instead of being told that X amount has to go into health insurance that you may not need.
I think you're right that we should have transparency in the notion of knowing what our healthcare costs are. And to answer the other gentleman's question on Facebook, let's just be clear that catastrophic care is not preventative care.
Yeah, but why do you have to buy what you don't want to buy? What if you want to pay for your own preventative care?
So the whole notion of being able to refocus our healthcare, everyday Americans with everyday healthcare, should be about preventative care.
Let's hear from the doctors' allies in the Doctors for America group. So your opponents are Doctors Against America? No, it's a very rigged name, but yes, doctor.
Hi, I'm a primary care doctor, and I like Dr. Goodman's idea that prices be more transparent, and I think doctors and patients should be more aware of prices. I am concerned of using the power of market to give people a disincentive to get primary care early. A lot of people might save the money for something else.
Yeah, what about that?
They end up
People
with a
won't
stroke,
get preventative
dialysis.
care because they don't want to pay for it.
Well, we found that when patients are managing their own money, they do get preventive care. And we've also found in the Medicaid program that disabled poor people can manage their own dollars, and they can do it quite well. If they're going to manage their own care, why not let them manage the money that pays for that care?
Yes.
Hi, I'm a doctor in New York, and I'd like to know why the Affordable Care Act is being called Obamacare, here, but also around the country. Everyone knows that the healthcare system in America is broken and has been broken for decades, and I'd like to know when the health of Americans is not going to be at the mercy of the political system and politicians, and
But wait a second, you make 2 points there. You're asking it to be at the mercy of the political system because you support Obamacare. And I call it Obamacare because these politicians' names, the Affordable Care Act, why don't we call all bills the Everybody Be Happy Act?
But it's a good question in this sense. We didn't get what Barack Obama said he wanted to give us, which was universal coverage with no mandates. What we got is this program put together by special interests. And that's why it's such a Rube Goldberg contraption that really nobody can understand or explain, because it's special interest legislation.
One more, yes, sir.
I'm a physician in New York also. I was wondering if each of you or all three of you know much about the VA health system?
Well, yes. The VA health system is a system run by the government. It does certain things pretty well, especially things that it grades itself on. Like it has electronic medical records, but it does other things very poorly, and that's why you keep seeing all those newspaper articles about all those vets that have psychological problems and they can't find doctors who will see them. So it's bureaucratic, it's inefficient, it's wasteful, it's not market-based health care.
The system doesn't meet their needs because there's not enough psychiatrists out there. The fact of the matter is the VA is actually an efficient healthcare system, and it covers very hard-working military men and women. So the fact of the matter is the VA, if we could have a VA health system for all of America, I think that would be something that everybody would want to pitch into.
If we had
Okay, on that note, we're out of time. Thank you, Dr. Sharma, John Goodman, Karen Hornett. Coming up, I'll solve America's healthcare problem.